Hi, so let us talk about osteodystrophies. First, let us talk about fibrous dysplasia. So fibrous dysplasia is a rare bony disorder which is non-cancerous in nature. It occurs due to mutation in GNAS1 gene. Now when this gene mutates, it gives rise to a lot of CAMP. We know that this CAMP will in turn stimulate a lot of osteoblasts. It will also stimulate a lot of endocrine glands and a lot of melanocytes. Due to this, the classic symptoms arise in fibrous dysplasia. Now, fibrous dysplasia can be of two types broadly. It can be monostotic, which is more common, in which generally the fibrous dysplasia will affect a single bone, or it can be polyostotic, where multiple bones will be affected. Generally, the bones which are affected most are your lower limb bones and your craniofacial bones. Of course, other bones may also be involved. Now, when it comes to polyostotic itself is of various types. The first is Jaf's type, in which you will have cafe au lait spots because the melanocytes were stimulated, and of course you will have multiple bone involvements. Generally, these bones can be craniofacial bones and even your femur, lower limb bones, right? Now, one thing which I just wanted to say about the cafe au lait spots were that they would have an irregular border resembling the coast of Maine in USA. Then we also have the McCune-Albright type. In this, other than the cafe au lait spots and the multiple bone involvement, you will also be in turn having puberty, precocious puberty. You will have a lot of endocrine problems. So this is something very important. Now for surgery, generally we go for a cosmetic, more conservative based surgery. Also one very important thing, fibrous dysplasia has various discernible features like ground glass appearance, right? Then it also has a characteristic Chinese or C-shaped letter trabecula when you see the histological slides. Other than that, Shepherd's crook deformity and rind sign are all very important. Then let us speak a little briefly about Paget's disease. So in Paget's disease, this generally occurs in elder population and more commonly involved in the maxilla. In Paget's disease, basically your bone, generally both the maxilla and the mandible, they will really enlarge, right? Your palate is known to become flattened. The dentures become tighter, right? Then the cranium descends. This is called platybasia. Again, both fibrous dysplasia and Paget's disease, they both can cause nerve compression. So when it comes to, these patients can also develop hearing loss and optic nerve compression and sarcomatous degeneration.